This is about the diarthrosis. This is about the diarthrosis, also called as synovial joints. These synovial joints are freely movable joints. Freely movable joints. In our human body, most of the joints are the synovial joints. Synovial joints. So, how these joints are freely movable compared to the synarthrosis because of presence of the see, suppose here will be having one bone, here will be having one bone. Why these joints only freely movable joints? Here will be having two bones. These two bones are covered by the joint capsule. These two bones are covered by the joint capsule. This is our joint capsule. This is outer layer. This is outer layer of the joint capsule. Outer layer of the joint capsule is nothing but stratum fibrosum. Stratum fibrosum. And inner layer, see, inner layer of the joint capsule we can tell like stratum synovium. So one joint capsule is the first point. Joint capsule is there to the synovial joint. And second point, here joint cavity, see, between these two bones, here we are having some space, how we got that space? Because of the this joint capsule. So second point, here we will be having joint cavity, to the synovial joint. So next, third point, here we will be having synovial tissue, that is where we can see inner layer of the joint capsule. Here we will be having synovial tissue. Third point, synovial tissue will be there. So that's one point. And next point, here between these two bones, here we will be having synovial fluid. Here we will be having, this is synovial tissue. Here we will be having synovial fluid. This is synovial fluid. So fourth point, here we will be having synovial fluid will be there. Next, fifth point, articular cartilage. Where we can see, suppose this is our bone. Here near articulating surface will be having articular cartilage. This articular cartilage, another name is hyaline articular cartilage. So because of the presence of first one, joint capsule will be having two layers. This is joint capsule. So outer layer of the joint capsule is stratum fibrosum, inner layer of the joint capsule is stratum synovium. So here one point, joint capsule is there. Second point, joint cavity. Between these two bones, here will be having some space, that is nothing but joint cavity. How we got joint cavity? Because of the joint capsule. Next, third point, synovial tissue. Synovial tissue will be present over the inner layer of the joint capsule. Here will be having synovial tissue. Next one, synovial fluid. So this is our synovial fluid will be present inside the joint cavity. Next one, articular cartilage. This is our articular cartilage. So these are the key structures. Of the synovial joints. These are going to make the joint freely movable. Apart from these structures, in synovial joints will be having menisci, ligaments, pads, and discs. So like that, so many structures will be there inside the joint. So many structures will be there between the two bony structures. All these five structures, with the help of these structures, either menisci, ligaments, pads, burrs, discs, fibers, cartilage, whatever. So all these things are going to make the synovial joints freely movable. Now we'll see one by one these special structures. Capsule. Suppose here we are having one bone, here we are having one more bone. So these are the two bones we are having here. The joint capsule, see, it will be between two articular surfaces. It is having two layers. Joint capsule is having two layers. This we know. Outer layer is stratum fibrosum. Sometimes this outer layer, stratum fibrosum, also called as fibrous capsule. Now the inner layer is called as the stratum synovium. So these are the names of the capsule. So outer layer is called as fibrous capsule or stratum fibrosum. Inner layer stratum synovium. What is this capsule mean? Suppose if we see shoulder joint, here the capsule will be weak. Because of that mobility is more in shoulder joint. If we see hip joint, here capsule is strong. Because of that mobility is less, stability is more. So here the point is capsule is going to provide stability to the joint. If the capsule is strong, mobility will be less, stability will be more. If the capsule is weak, mobility is more, stability is less. So this is the reason why so many patients they'll get shoulder injuries, means here capsule is weak. So that's why because of more movements and more mobility, patient will get injuries over the shoulder joint. Okay, synovial fluid. Suppose here we are having one articular surface, here we will be having one more articular surface. This is our joint capsule. Between these two articular surfaces, here we will be having joint capsule. So that synovial fluid will be present here. In the form of thin film. So this is our synovial fluid. What is the function of this synovial fluid? Means it is going to reduce the friction. Between these two bones. At the same time, here we will be having articular cartilage. Nothing but hyaline cartilage. Here also will be having articular cartilage, nothing but hyaline cartilage. So that this thin film is going to reduce the friction between two bones. At the same time, between these articular cartilage also, and between, see here, this is our joint capsule. The synovial thin fluid film, it is nothing but synovial fluid film. This thin fluid film is going to reduce the friction between joint capsule and bone. Also, it is going to reduce the friction between joint capsule and bone. This is about synovial fluid. So the composition of synovial fluid is almost equals to the blood plasma. Only few exceptions is there in synovial fluid. So here synovial fluid is consist of hyaluronic acid. Hyaluronic acid will be present in the synovial fluid, and one more glycoprotein, that is lubricin. Lubricin will be present. Okay, so that the composition of the synovial fluid is almost equals to the blood plasma, except here hyaluronic acid will be present in the synovial fluid, and glycoprotein, lubricin will be present in the synovial fluid. So that these two are going to helpful in the weight bearing, the same time in the reduction of the friction between articular surfaces. So that if any injury, if any abnormalities happen to these two structures, then it is going to affect the total joint weight bearing, friction, and one more here the special point, lubrication. Joint lubrication will be affected. Lubrication means one more articular structure, how this structure is moving over this structure, that is nothing but lubrication. If any changes will happen in this hyaluronic acid and lubricin, it is going to affect the joint lubrication. Okay, we saw its composition we know, and its function also we know. What is the composition, what is the function of this synovial fluid? Now we will see color of the synovial fluid is the clear pale yellow color. Of synovial fluid will be present in the all synovial joints in small amount. Right? Small amount it will be present in all synovial joints. Okay. Now if we come to the property, like all connective tissue structures, here also will be having a property that is nothing but here viscosity. Okay, suppose if we are moving joint fast, so that the fluid will give less resistance, nothing but less viscosity. If the viscosity is less, means movement will happen very freely. If we are moving joint slowly, so that resistance will be more, that is viscosity, resistance will be more. Who will give more resistance? This synovial fluid will show more resistance to the movement, so that movement will be less. Here the point is synovial fluid, if you move the joint fast, then the viscosity of the fluid will be less. So that if viscosity is less, means between these two articular surfaces, if viscosity is less, means fluid will move very freely between these two bones, so that movement will happen very nicely. And if the viscosity is more, if the viscosity is more, so that here the fluid will not move. The fluid will not move freely between these two atlas surfaces, so that movement will be slow or less. So this is about the synovial fluid.